Case Files Collection features hundreds of cases in the basic sciences, clinical rotations areas, and in postgraduate studies with real-life patient cases that feature comprehensive quizzing and clinical takeaways. Case Files Collection covers 23 biomedical science and clinical medicine categories with an array of real-life cases within this single user-friendly interface. This collection is primarily user-driven and helps users to learn and apply basic science and clinical concepts in the context of realistic patient cases. The cases here are a great resource for medical students, residents, clinicians, and faculty who want to incorporate case-based learning into their courses, and these are great preparation for board exams, including the USMLE, PANCE, and APN exams. In getting started, please ensure that you are authenticated with your institution's subscription, which you will know in the upper right where it says Access Provided By, and it should indicate your institution name, which lets you know you can access your subscription. Please then sign into your free Access profile or create your profile. By signing into your profile, you will unlock all the case functionality and can complete the case quizzes. The Case Files Collection cases provide materials for short, targeted case-based learning that require students to think critically about the content. Each case will vary slightly, but in general, you'll get a patient history and systems review, some short answer questions, clinical pearls or key takeaways of each case, as well as references and a comprehensive quiz. These cases provide real-life patient scenarios to prepare any student or resident for what they may encounter in the clinical setting. Let's begin with a look at our basic science cases. Each of these categories features 50 or more unique cases, and all feature board-style review questions to align with the USMLE and shelf exams. Let's take a look at cases in pathology for an example. Mastering the knowledge in a discipline such as pathology is a formidable task. It is even more difficult to retain this information and to recall it when the clinical setting is encountered. To accomplish this synthesis, pathology is optimally taught in the context of medical situations, and this is reinforced later during clinical rotations. The gulf between basic sciences and the patient arena is wide, and perhaps one way to bridge the gulf is with these carefully constructed cases that ask basic science-oriented questions. Here we have a collection of patient cases to teach pathology-related points, and more importantly, the explanations for these cases emphasize the underlying mechanisms and relate the clinical setting to the basic science data. We explore these principles rather than emphasize rote memorization. If we were to open a case, notice the case is organized across the top in a series of tabs, designed so that you can progress through the case with the patient presentation and general overview information, as well as any relevant figures and some open-ended questions. You can also reveal these answers, and here you can see the clinical correlation, and this all really helps to reinforce learning and practice. The approach will feature more clinical information such as definitions and discussion, as well as any other relevant figures or other clinical data to help you form your diagnosis. Pearls are the clinical takeaways, the key things to remember about each case, as well as a series of references, and finally your comprehensive quiz. You can view the answers as you go, and so short answer explanations are available also to help reinforce learning. And of course you can view all of your answers at the end. Here you can see your score, again with correct and incorrect answers and short answer explanations. Please note you do have the option to retake your quiz, as well as to print the results or to email the results. So this is a very convenient way for you to share the results of your case quizzes with an instructor who may have assigned you the case. As a note for any faculty, in order to embed any of our cases on this site for case-based learning, simply copy the browser URL and embed that in your learning management system, in an email, course syllabus, or other course materials for students to click the link, sign into their profile, and complete the case activity. Users will want to be sure that they are authenticated with your subscription. Let's now take a look at our clinical rotation cases. These cases also feature real-life patient scenarios to sharpen critical thinking skills for your clerkship and for the shelf exam. These are high-yield cases which illustrate essential concepts in patient care, and you will see that each case begins with a vignette accompanied by relevant open-ended questions designed to teach diagnostic and therapeutic approaches relevant to practice, and the answers that follow these open-ended questions emphasize mechanisms and underlying principles, as we shall see. These realistic cases are accompanied by comprehensive quizzes again that encourage you to think through the differential diagnosis and treatment options with high-yield discussions that are aligned to clerkship guidelines. These are USMLE-style review questions, and clinical pearls accompany each case, which help again to serve as a primer on how to approach clinical problems and think like an experienced physician. One thing to draw particular note to is the introduction and how to approach clinical problems sections of these cases over on the left-hand side in each case. These are very useful guidelines for how to get the most out of these cases. So here we are providing users with a description of our case formats, including summary, where students should formulate a summary of a case before looking at the answers, helping to improve their ability to focus on important data and discard irrelevant information, a fundamental skill in clinical problem solving. Our analysis of the cases with objectives and considerations, all of the key points in your approach to a specific patient, and challenging students to make educated guesses about the objectives of a case upon initial review of the case scenario, again to sharpen clinical and analytical skills. We also outline our approach to the disease process in these cases, including clinical definitions and terminology pertinent to the disease process, and the clinical approach, a discussion to help users form their approach to the clinical problem in general, with any relevant tables, figures, and algorithms. If we scroll back up, review the How to Approach Clinical Problems section, we also outline our approach to the patient, clinical problem solving, and approach to reading through these cases. For example, patient history being the single most important tool in obtaining a diagnosis, including basic information, chief complaint, history of present illness and past history, allergies, medication, family history, etc. We also cover physical examination, vital signs, head and neck exam, general appearance, helping students to really focus on the physical exam when approaching these cases. Student users will also see relevant laboratory and imaging, such as lipid panels, urine analysis, hemoglobin, blood count. We also outline ways of interpreting test results using pretest probability and likelihood ratio. For example, knowing about the characteristics of the test you are employing and how to apply them to the patient are essential in reaching a correct diagnosis. Once again, these cases then are really great material for developing diagnostic skills, including an approach to clinical problem solving, such as making the diagnosis, assessing the severity of the disease or stage, rendering a treatment based on the stage, and following the patient's response to treatment. This section of our cases outlines, for example, pattern recognition, those features of a patient's illness that match a scenario the provider has seen before. This section of our cases really provides terrific guidance for making the most of these real-life patient scenarios to really help them practice and review patients that they may have encountered or will encounter at the point of care. Another feature in this section of our cases is the approach to reading. This is the clinical problem-oriented approach to reading that is different from the classic systematic research of a disease. And there are several fundamental questions that facilitate clinical thinking, which we outline here. These are really key skills and questions that students and other users can apply to our cases to really maximize the benefit of case files collection. I do want to point out our podcasts. Case Files Collection is mobile friendly, and of course you can listen to these episodes on our Access app. We have podcasts available in 4 different areas. In these episodes, Dr. Eugene Toy, the primary author of the Case Files case series, interviews specialty authors and provides additional tips and pearls or key takeaways of these cases in an interview-style format. Thank you for watching this video on Case Files Collection. If you have any questions, please feel free to reach out to the McGraw Hill support teams. We have our training and support tools available, as well as a way to contact us. Or you may reach out to McGraw Hill Customer Success Team directly at customersuccess@mheducation.com. Thank you.